Hi, I'm Schuchita Sharma, one of the nephrologists at Mount Sinai. I'm an assistant professor of medicine at Mount Sinai Hospital in the Division of Nephrology. Um, I'm, I specialize in home dialysis, and I will like to talk about the home dialysis today. Thank you for joining us today. So kidney failure, which is also called the end-stage kidney disease, it means that the kidneys have stopped working well enough for someone to survive without dialysis or a kidney transplant. So while kidney transplant is the goal for most patients with kidney failure, there can be a significant wait time before an organ becomes available for the patient to receive it, or some patients may be too frail to undergo and survive the transplant surgery. So these patients would require dialysis as a life-saving therapy. So dialysis is a treatment that is used to perform some of the things that the natural kidneys do as such, by like removing the waste and the water from the patient's body. Now, the dialysis can be performed in the center by trained nurses and technicians, or it can be performed in the comfort of patients' homes by themselves. The in-center dialysis is performed usually 3 times per week for about 3 to 4 hours every treatment. And then home dialysis is usually more frequent, and it is done in the comfort of the homes, and it's kind of gentler and more close to how our kidneys function. The home dialysis can be performed in two ways. It can be done either as peritoneal dialysis, where the dialysis is performed by using the lining of the patient's abdomen and putting dialysis fluid in the belly. The second way of doing that dialysis at home is hemodialysis, where needles are inserted in the arm of the patient and the blood is taken out and cleaned by a machine. In both these modalities, the patients and or their family members or their care partners are trained extensively in self-care dialysis. So one of the foremost benefits of doing home dialysis is the flexibility that it gives to our patients. So the patients can perform dialysis at their own convenience and availability rather than at the fixed times that is required on fixed days for the in-center dialysis. One of the biggest challenges of starting dialysis is the changes that it brings about in the patient's lives. Dialyzing at home helps them keep their work, social, and school life somewhat similar to what they had before initiating dialysis, as they can schedule their treatments around their life. Also, as I mentioned earlier, the home dialysis is usually performed more frequently and is kind of gentler on the body. Most home dialysis patients feel improved quality of life as well as an improved mood and energy levels. There is usually lesser dietary restrictions for these patients, and also fewer medications that these patients require. Patients also have a shorter recovery time post dialysis than for the patients who do dialysis in center. Home dialysis is also beneficial to our patients because this requires fewer visits to the treatment center and hospitals. And this benefit has really become much more prominent during the COVID-19 pandemic, where there was requirements for patients to be away from other patients or other people. And I think dialyzing at home gave them that flexibility and comfort. So I think for most patients, any patient who starts on dialysis or is on dialysis already should first of all be informed about all the treatment options. And if the home dialysis is something that works for them, it is something that is conducive with their lifestyle, it definitely should be explored and taken care of. So basically, any patient who is interested in doing dialysis at home should be able to get all the information and make the decision whether this is something that is okay with their lifestyle or not. I think home dialysis is a self-care modality that empowers our patients to take active involvement in their care and also do it with their flexibility. I think this requires some commitment from the patients and their families. So I think it is definitely an option that is available for most of our patients, but I think it has to come from the patient whether they are willing to do this and take care of themselves. At Mount Sinai Home Dialysis Program, we have both the modalities, both peritoneal dialysis and home hemodialysis. We offer both to our patients. Any patient who is close to dialysis, we try to educate them on these modalities. And if we help them take an informed decision about what modality would be best suited for them based on their personal preference. The patients are extensively trained in the dialysis modality. So it's usually about 2 weeks for peritoneal dialysis and about 5 to 6 weeks for home hemodialysis. And once the patients are ready in terms of doing it on their own, these patients go home. But then they are really very closely monitored, and they are the dialysis nurses and the doctors, they work very closely with them and provide constant support in terms of video visits, remote monitoring, and phone calls. So some patients may have this concern whether home dialysis is something where they go on their own. But really, I mean, even though they are home by themselves, a lot of times they're not doing it on their own. They have a lot of support from the nurses and the doctors who are taking care of them. So I would say that I think home dialysis really empowers our patients. I think it is one of the modalities or one of the ways of doing dialysis where where the patients can actually continue to do what they like to do, and at the same time, dialysis, which brings about a lot of changes in their lives, there's one part that they can take care of, which is basically taking hold of their own time, right? And there are many other benefits that we talked about earlier, which would really help the patients continue with their life while they're waiting for a kidney transplant.